through your drills, but they also really understand what the responsibilities are for different people in the building, and that's all shifts. So it's, it's not just, yes, I do this and this, but to understand what each level, if that person's not in the building, who's gonna do that? And then obviously ADL care. So those are some of the topics that we're seeing under the A81. So under A81 as well, under in-service training, we know that new staff must have 2 hours of in-service orientation prior to interacting with the residents. The facility, I mentioned the infection control policy. The staff must have a 1 hour in-service training, which includes universal precautions, the facility's sanitation procedures, and that's before providing direct care to the residents. And you want to have your own policies and procedures. We want to see that you have trained your staff to what you expect in your building, not necessarily somebody's, generic policy, because it may not be exactly what you're doing. And that's what I find a lot of times, that what the staff is telling me that they're doing, and I'm observing them, and then I look at the policy and it doesn't mesh. So you want to make sure that you're looking at that. So for the elopement training, within 30 days of employment, again, you want to review your specific policy and have a copy to your employees, and they want to demonstrate that they understand and they're competent, and that's across all shifts. Number 3, assistance with self-administration of medication. This always is in our top 10. Again, we look at MedPass during our surveys to see how the staff are doing. We want to make sure that unlicensed staff are not administering medications, and that the employees, the staff, are following the assistance with self-administration guidelines. I put this slide up here. It's not in the top 10 for 2024, but it's trending of this year. And this includes the medication records, which many times it's already in the top 10, but so far this year, this one seems to be a lot higher than we've seen in the past. And just to go over this with you, the facility must make sure that there's a resident maintained a resident daily medication record for each resident who receives assistance with self-administration of medication or a medication administration. And this includes the time the medication is taken, any missed dosage, refusals, or medication errors. A lot of times we're not seeing those last few things on the MORE. It's important that that's documented. And we know that the MORE must be updated immediately each time the medication is offered or administered. So this was an actual citation. So, this is just an explanation that the facility must keep either original labeled medication containers or a list of medications, which includes a prescription order number, the name and address of the pharmacy, the healthcare provider's name, resident's name, date dispensed, and name and strength of the drugs and direction for use. So this was the case study. This was a review of 6 residents. The surveyors found the facility failed to ensure medications were given to residents. All who required assistance with self-administration medication, and this was over a 1-month period of time. So here's the results of that. So a lot of busyness on here. I'm going to give just a brief explanation, but you can see on the far left there's 6 residents, and then up at the top you can see the different types of medications that were missed. What is alarming, literally all of them are alarming to me as a nurse, but you can see that resident number 5, he missed his hypertensive diabetic medications, anticoagulation medications, his seizure medications, numerous times. And this was not just an isolated incident. There were 6 residents that these are the amount of medication doses that were missed in a 1-month period of time. So that was pretty extreme. So